So here we're shifting to the ethical component. Again, why should we care about this? Why should we care about self-care and avoiding burnout? Well, we want to ensure a high quality of client care, and there are ethical mandates for mental health professionals to self-monitor for their level of well-being. Not only are we mandated to seek professional consultation when our personal functioning may be impeding our ability to provide effective therapy or clinical services, we are also mandated to limit or suspend professional activities until we're in a better place. So here's a long ethical code. I'm going to go ahead and read the code to you. You'll also have it in the PowerPoint. Impairment. Counselors are alert to the signs of impairment from their own physical, mental, or emotional problems and refrain from offering or providing professional services when such impairment is likely to harm a client or others. They seek assistance for problems that reach the level of professional impairment, and, if necessary, they limit, suspend, or terminate their professional responsibilities until such time it is determined that they may safely resume their work. Counselors assist colleagues and supervisors in recognizing their own professional impairment and provide consultation and assistance when warranted, with colleagues or supervisors showing signs of impairment, and intervene as appropriate to prevent imminent harm to clients. This is from the American Counseling Association Code of Ethics. And here we see the sense of a community of professionals who are looking out for each other to ensure that clients receive appropriate care. Another ethical code specific to mental health counselors. Mental health counselors are mandated to recognize that their own effectiveness is dependent on their own mental and physical health. Should their involvement in any activity or any mental, emotional, or physical health problem compromise sound professional judgment and competency, they seek capable professional assistance to determine whether to limit, suspend, or terminate services to their clients. This ethical code comes from the American Mental Health Counselors Association. And here we see that responsibility on the professional to self-monitor and to seek support. The American Psychological Association mandates that psychologists refrain from initiating an activity when they know or should know that there's a substantial likelihood that their personal problems will prevent them from performing their work-related activities in a competent manner. Here, the responsibility lies squarely with the mental health professional to ensure that clients receive proper care and that all work-related activities are conducted in a competent manner. The American Association of Marriage and Family Therapy mandates that marriage and family therapists seek appropriate professional assistance for their personal problems or conflicts that may impair work performance or clinical judgment. Again, the responsibility for maintaining well-being and for addressing potential impairment rests solely and squarely with the mental health professional. So, what are some factors? We realize that we are ethically mandated to maintain our well-being, to monitor ourselves, and ensure that clients receive appropriate care. What are some factors that may buffer mental health professionals from emotional exhaustion, an important aspect of burnout? Well, coworker support is a key factor. So if you're in an environment where you don't feel a sense of coworker support, I encourage you to seek consultation outside of that environment to get that support that you may need. On the other hand, a lack of needed resources is associated with increased risk of burnout. So if you're working in an agency or in a setting where there have been a lot of budget cuts, you're feeling that increased demand with less to kind of complete the job, I encourage you to seek other forms of support because you may be at a higher risk for burnout. Moreover, large client caseloads have also been associated with burnout. Also, providing clinical services to clients with severe diagnoses and presenting problems has been associated with burnout. And exhaustion and cynicism tend to emerge from the presence of work overload and social conflict, whereas a sense of inefficacy arises more clearly from a lack of resources to get the job done. So you may be in an environment where some of your needs are met and some aren't being met. I encourage you to consider ways to get those needs met, even if this involves meeting for lunch with colleagues once a month or some way to get the support that you need, if possible. If you cannot get the support you need, that's where self-care practices come in to help you buffer that stress. So ongoing research on the causes of burnout and ways to prevent it is still needed. But some correlations have already been found that seem to reduce burnout. One of them I've mentioned, self-care, social support. Actually, both of those I've mentioned. Those are two factors that have been studied. Getting social support from colleagues, supervisors, and social support in your personal world with friends, family, loved ones. And practicing self-care, practicing those activities that have positive short-term and long-term benefits. Examples of those include potentially an exercise practice that helps you manage current stress and also has positive long-term consequences. Another interesting fact is that engagement can be understood as the opposite of burnout. So if you're finding you feel disengaged from your clients, from your job setting, from your colleagues, that's a potential risk factor. So finding ways to healthily, with health, engage with your colleagues, with your clients. And here, some information about a study. Professionals who used positive coping strategies. I've mentioned some, but here are some more. Using humor, exercising, gardening, listening to music, and seek both emotional and instrumental support. Emotional support, talking to your friends and family. Instrumental support, talking to a supervisor, a trusted colleague, someone who can help you address clinical or other work-related issues. These professionals reported lower levels of work-related stress and burnout. So what are some next steps? One suggestion is to seek out mentors. Are there mental health professionals in your work context whose clinical work you admire, who also seem to have a healthy family life, community life, friends outside of work? Seek them out and learn from them. That's one great option. Finding someone who you admire, who doesn't seem to be just draining themselves to be a great professional, but they seem happy and alive themselves, and they're also a great professional caring for other people. One of the benefits of this program right now is it's my attempt to start creating a dialogue about the value of self-care with colleagues, and I encourage you to continue that in your own setting, talking with others about your triumphs and your struggles. And this goes back to compassion satisfaction. Many of us have a genuine motivation to be of service to others, and connecting and reconnecting with that motivation when we're having a stressful day, when things didn't go well. Okay, what led us to this field? What can we do to be of benefit to others? And as I was just mentioning, engaging with your professional role, connecting with compassion satisfaction in your clinical work. People come to counselors and psychologists frequently when they're at the lowest point. They're really needing help. And if we're ready to receive them and connected with our passion and motivation to help them, then we can be our most effective and be of the highest service. As I've mentioned before, seek ongoing supervision and consultation. And then, if possible, some settings may be more open to this than others, discuss community values. Are there ways to change the broader organization or institution so that it can be more supportive of each individual's well-being? You may be surprised that more and more work organizations are open to discussing wellness initiatives because they recognize that healthy employees are more productive employees. So you may be surprised that your organization and your supervisors may be interested in these ideas. Then moving to the individual level, discussing your own individual values related to self-care and wellness, well-being. Finding trusted friends or colleagues to discuss this with. And finding self-care practices that work for you. Some of you may already know, when I exercise, I just feel great. If I take the time to do that, I'm gonna be my best. Or if I do my spiritual practice, whether that's prayer or meditation or whatever it may be, then I know I'm gonna be centered, I'm gonna be able to help others. So if you already know the self-care practice that works for you, then do it, practice it. If you're already doing it, keep doing it. And if you don't know what might help you, if you're like, you know what, I've never connected with anything, I know I need to do something, that's when I encourage you to take some time to explore activities, whether it's through a practice, a class, a church organization, other religious organization, or it's through a community center, something that would connect with you. So self-care and effectively implementing self-care takes time and practice. And I hope that this program has helped you take some of that time. Knowing and trusting yourself, your needs and personalities, your strengths and weaknesses. And recognizing contextual constraints to implementing self-care. If you're a new mom and you're working at a mental health counseling agency and you have demands from family and friends, realistically it may be harder to implement, I want to meditate an hour every day. That may not happen, but is there a way that you could implement a 5-minute practice? That's just an example. Or, I would love to go to the gym every day. Well, maybe that's not practical with the constraints in your life. Okay, well, is there a way you could start going once or twice a week, get someone to babysit your child, go to a gym that has a daycare, things of that nature to try and really integrate it in your life. And this is a practice as well. Practice believing that the time it takes to care for yourself is worth it, and then prioritizing it accordingly. And here's something that I continue to return to, which is cultivating a compassionate relationship with ourselves. So sometimes we might experience a setback. We might have gotten off track with our self-care goals, or we might have been overwhelmed with family and work demands. So rather than treating ourselves harshly, why didn't I keep going to the gym? Why did I let my spiritual practice go? Trying to be compassionate and gentle with ourselves. Using positive self-talk, the things we might tell clients to help us get ourselves back on track. And then when needed, seek professional counseling or psychotherapy for yourself. We're counselors, we're psychotherapists, we're marriage and family therapists, we're psychologists, and we know the value of these services, and we're not immune to the stresses and strains of life. So finding, if we need that help, go seek it out. And then again, seeking ongoing social support from your peers, colleagues, supervisors, mentors. And here we have some references related to this presentation. I want to thank you so much for attending to this presentation, and I encourage you to use these self-reflection questions in your journey towards greater well-being.